Now we're ready to start the bonding process. Remember that we always start at the second bicuspids when we bond, because that is the shortest tooth in the mouth. And many a times, even though we have a pre-selected height, if the tooth is too short, we may have to make adjustments to that height. If we don't make those adjustments, you will end up with a cant on your occlusal plane as well, or a possible posterior open bite. You will lose control of the vertical. So always remember, we start with the second bicuspid. So again, right to left, please. Oops. Please notice that even though I'm using my left hand for support, I'm not putting my fingers anywhere near the teeth. Using the height gauge, I position my bracket at the desired height. Little adjustment here for the angulation with the end of the and a quick check for the height. That is correct. So then we move on to the next bracket. And I can just refine the planing if necessary while the next bracket comes to my hand. Notice how beautiful access I have to the FlexiBond retraction system. There is no other retraction system that offers this. I did not have to come in an angle and then reposition my bracket. And that allows for more precise bracket placement. Okay, let's just see this. I'm at the right height. Next. So now I just confirm my height and position, and can I have the next bracket, please? Sorry, thank you. Keep in mind, you want to press the bracket really tight against the tooth. And here to the height gauge. And make sure that the bracket is in the right place. Next, and I need you to turn a tiny bit towards me. Thank you. And we continue bonding. Now we're at the canine. We're going to have to make a cut. And again, using the gauge, we make sure that we have the tooth at the right height. And then I look from behind the patient and above and to the right. I get up a little bit to make sure that I have placed the bracket in the right position. Okay, next. As you notice, I'm using also the back of the gauge. Sometimes I use it to help me push the bracket into position, allowing me to see, have a better approach to the tooth. Okay. And also to get the correct angulation. So I check and clean the excess cement. And I'm gonna wait. And the bonding process is complete. At this time, we take all the cotton and the retractors. Raise your head for me. Thank you. I'm sorry. And we allow the patient to clean and rest. As you can see, I clean up most of the color on the lower with a Profi cup, but when the patient rinses, it's going to look kind of like what you see on the top. And then if the patient just gets off the chair and brushes her teeth, if not in the first time, the second time all the color will be gone. So we're going to place an 012 nickel titanium alignment arch wire. And one of the things I'm going to do, I place the wire and I hold it with my fingers, and then with a Sharpie marker, I mark distal of the bracket of the bicuspid on both sides. So I can put a bend right distal of the bracket of the wire, and that will allow, give patients some comfort. Now I have pulled the wire and I can see the dot right here where the plier is holding. So right at the dot, I would grab the wire and I would just turn. And you can see, even though this is nickel titanium, the wire undergoes permanent deformity. So you want to turn your plier about 180 degrees. You just want to turn it, and that will give you a little 90-degree bend, so the patient will be more comfortable and the wire will not be sticking out, cutting her face or her cheeks. So you can see the little bend. And we do the same thing on the opposite side. So again, I'm going to remark. Sorry. Okay. You can have your assistant mark for you, because you have to hold the wire in place. And here's my mark. And I hold right at the mark. Can you see that? And then with my plier, I will twist the wire about a full turn, really a nice twist, to produce this little bend. Then I can cut the wire, and the wire will be pointing towards her teeth. Now we just seat the wire back and make sure that our bends are correct. You want to have, no, let me show you. You want to have your assistant, can you see this? Pass you the ligature with a little bend. So when the ligature is passed to you, can you grab it right here? Right here. So when the ligature is passed to you, you just grab it, and then you can slide it onto the bracket. Now, once you have the ligature slide onto your bracket, use your middle finger and twist your hand, and you start the twist. Put your fingers over the bracket so it doesn't loosen up. Grab close to the bracket so you don't have to twist a million times, and your first bracket, it's tied. Again, the assistant passed me the tie already pre-bent, and I just slide it over the tooth, twist my fingers, hold, and tie. If for any reason your assistant, which is actually the person that should be doing this, does not have an assistant, you can have your patient, bring your hand closer, you can have your patient hold the ties for you, so your assistant can just grab the ties directly from the patient's hand. Now, notice I tend to put my finger over the tie that I just placed, just so as I grab my wires, my pliers, I make sure that the tie is not going to come off that bracket. And again, just slide it through. Turn away from me, again. Just slide it through. Twist your fingers, and you have your tie. I typically hold it with my finger right on top of the bracket. Grab my Matthew plier and twist. The rotation of the pigtail goes towards the rotation of the tooth. If the tooth is mesially rotated, you want to have the pigtail like I'm doing here on this bicuspid. Turn away from me. Like I'm doing here on this bicuspid, you want to have the pigtail pointing to the mesial.
Or said another way, where the wire is farther away from the bracket.
From the bracket. In this case, we have a slight mesial rotation. So one of the things I like to do, you have a ligature director?
No, that's it.
I like to either with a ligature director, or in this case with dirty sickle. With the sickle, I push on the wire so I get full deflection of the wire into that bracket slot and finish twisting. And now I have this wire totally activated. We move to the next side. All right, how are you, dear?
Good.
Where's my bracket, my wire right here. I'm gonna go ahead and put the canine. So the tying process is not a complicated one. Just make sure that you keep your pliers not too far away from the tooth. I always keep twisting the excess wires so they are not on my way, and by putting them all together, I don't have to worry about picking one wire at a time when we're cleaning up and cutting the excess ligature ties. There you go. You can see my finger holding the ligature so it doesn't move while I'm grabbing the ligature with my pliers. I put all the ligatures together. As you can see, in this case I made a little knot in here, and now close tiny bit. Put my fingers in there to protect the patient from being poked with the ligatures, and I cut and push the ligature out of the way. So if you train your assistant to do this, then she can work by herself without having anyone else in your office having to sit on the chair while wires are placed or changed. Then make sure that the excess ligature ends up on your sharps disposal, and you can use the tip of your Matthew plier to push all those pigtails away from the bracket, from the teeth behind the bracket, or at the same time as you're cutting, you can just snap, and with your pin and ligature cutter, you snap, and at the same time you push the little pigtails. All pigtails should be pushed towards the tooth, as they can be really sharp and irritant to the lip, to the point that the patient is not going to be happy. So this is the upper arch, fully tied, and then we'll repeat the same process on the lower. So now for the lower, the wire has been precised using her study models. You don't want to come in with a full wire that will end up poking the patient back in the throat. I'll sit the wire, hold it with my finger, and make a little mark distal of the bracket, and we'll do that on the other bracket. I bring the plier out, I hold the plier again at the dot, not using the tip so it doesn't come out of your hand, and bend really tight, and you will have a definite bend on your night eye. Sorry.
That's right.
Then I just cut behind that bend, and we get a little like an L shape bend that will hide behind the bracket, and it's not going to hurt our patient. I place the wire again, to confirm that my bend is in the right place. And then we go ahead and just, you can have your assistant grab the wire exactly where you want to and bend it for you. We got right distal of that bend. And now we can start tying our arch wire. With this patient, she has teeth that are pretty straight, so there is not a lot of difficulty. But there are situations where you have patients with severe crowding. You want to secure the wire. When you have situations like that, you want to secure the wire on one of the teeth, and then you want to tie the most crowded tooth first, and then followed by the easier teeth, as you will have more wire flexibility to do that. So on this side, you can see that the lateral incisor, it's a little behind. So in order to if I tie the lateral and then the canine, I will have less wire flexibility. So at this time, I'm gonna go and tie that lateral incisor. Since the tooth has also a mesial rotation, I will place my pigtail towards the mesial, where there is more deflection of the wire. The pigtail is placed towards the mesial with the objective of having the tightest part of the tie towards the rotation. Notice how I use my sickle to push the ligature tie very tight against the bracket, so I don't have any slack. Now we just pass our ligature tie and start twisting. I'm doing this left-handed so they can see, but I can't because I don't want to break the brackets. Open up a tiny bit for me. You can have your assistant push on the wire, push hard, to get full engagement. This is a very light wire, and then your tie is complete, and hopefully you can notice the deflection of that arch wire. So secure the wire and then go and tie the most difficult teeth. You can push with your nail like I'm doing in here to bring the tie close to the bracket. You don't want the distal aspect or the loop aspect of the tie to be too far away from the tooth. And now we just proceed to tie This lateral also has a small mesial rotation, so the tie also goes towards the mesial. I want to make sure that that tie is tight, so I push. Now, with a sickle or a ligature director, we push the wire towards the bracket to gain full engagement. You do not want to have your pigtail or your twist try to push the wire. Don't attempt to push the wire like that, because the wire does not get enough deflection. There is not enough force, and you don't get enough deflection, and it will take you ages to be able to fully derotate that tooth. Use either a ligature director or a sickle so you can efficiently get that tooth derotated. Also, this cement, even though it's hard within the first 8 to 10 seconds, it really takes time to fully cure. And if you are stressing the bracket by trying to bring the wire in with the pigtail by putting force, you might end up debonding your bracket. So it is much better idea to push the wire fully with an instrument and then just tie. Okay. That'll close her bite. That step will close her anterior open bite. Now you've seen me after every tie grabbing the plier. Sometimes if you want to tie faster, you can just secure the tie with a couple of twists and then get the next tie, have it ready, and secure the next one and go along that way and then tie each individual tie. That is another way to do it. It is up to you. I prefer the method of fully tying a tooth at a time. But if you like to do secure all the brackets and then, just like I did right now with these last two brackets, and then tie the rest of the teeth, that is also okay. We make sure that we have all of the wires together so we don't have wires all over the place. You know, we put them on a little bow and then turn away from me. You can cut and push. Make sure that your tie is not, your pigtail is not very long, maybe 2-3 millimeters, so it doesn't end up poking the patient's gum. You want to push that pigtail tied against the tooth towards the contact so the patient can brush. Now I said can floss. I said towards the contact, not into the contact. So we cut the ties short, maybe 3 millimeters long, and we push it towards the contact, nice and tight against the tooth. We don't want the tie poking the patient's papilla, and we don't want it to stick out or the patient will not be able to floss. You saw me using the end of a sickle to push those two ties because the contact is very tight in there, and my plier may just torque the bracket and break the cement because it's too thick. So like on this case, I would use a thinner instrument like my sickle. You can also use a ligature director and push the wire towards the contact. There you go. And now we just push in the last two pigtails. And you can see that just with the time that we have spent tying the wire, most of the color, it's gone. So no carnival for you.
Yay.
So at this point, we're done with the bonding of the upper and lower 5 to 5. This is the time where the patient gets oral hygiene instructions, where the patient gets flossing instructions, and then we'll see the patient in 6 weeks.